My name is Ivan Pena. I'm the interventional cardiologist and director of heart and vascular at Nanticoke Memorial Hospital. Since I've been here in this community, working with heart patients, comes to the hospital with different problems like having heart attacks or manifestation of the coronary artery disease, heart failure. We also see a good amount of patients that have problems with getting amputations because they come with a wound, infected wound, or gangrene. And it's amazing that in this country still the most common treatment for patients with this kind of problems, with peripheral vascular disease, they come with the wounds or gangrene, still an amputation. 6 out of 10 patients that come to the hospital with this condition will require an amputation. And over half of them, they will have the amputation without any non-invasive diagnostic procedure like ultrasound or evaluation of the circulation. And it's not just the amputation. When you have a patient what we call critical limb ischemia, that means that is an acute inflammatory process that causes impaired blood flow to that limb. These patients will die in 5 years, probably 6 out of 10. So we're talking about a condition that can kill a lot of people in this country. And over the last few years, with the technology, now we can bring these patients to the cardiac catheterization laboratory and try to reestablish blood flow very quickly. And because of that, in the United States, there are some centers, and Nanticoke is one of them now, the few that have this program. Same program that we have to cover for someone with heart attacks, we have it for patients that have limb ischemia or impaired blood flow for the extremities. A 24/7 program that a patient can come to the hospital if they are very, very acutely ill, and then we can reestablish blood flow and prevent an amputation. And this patient can go back and heal the wound or get out of the gangrene, and then can be back walking with their limbs and do pretty much a normal life. At the same time, patients that have critical limb ischemia, they are the patients that we are target for our SAFE program, also have the same risk factor for heart disease, such as smoking, diabetes, high blood pressure, high cholesterol. So once the patient is captured and we do the evaluation, we're not just doing the evaluation for the limbs, we're doing the evaluation for the heart. And sometimes the limb is just the initial presentation, but might save the life of this patient because now we're going to recognize that he also has disease in the heart, and then we can treat that too. So now with this program, we have a 24-hour, 7 days a week line program that any physician or any patient can call, and within an hour we can take care of that patient, wherever he is in the area, in the community. We can bring the patient, do the non-invasive evaluation that will involve doing what we call a AVI. AVI is a test that will measure blood flow to the limb. And also we're going to do ultrasound, and if the patient needed to be admitted, we keep it in the hospital. And if we need to do the procedure to establish blood flow, we can do it within 24 hours of the patient arrival to the hospital. Now we have doctors from in the community. We have a network that now they have this program in their offices. The foot doctors also have it. We have a wound care center. We are approaching the nursing homes and all the medical facilities in the area, urgent care, to have the program that just one phone call away, they can serve their patient, and we can save a lot of lives by doing this program.